If your health insurance premium went up this year, you're not imagining it. Premiums went up, deductibles went up, prescriptions went up, and it's not just inflation. There are real forces behind this. Today, we're going to talk about what's really driving these increases and what you can actually do about it. Welcome to Insurance Unwrapped, where we strip away the jargon, unwrap the truth, and talk about what insurance really means in everyday life. Whether you work with Core Insurance Services or another agency, we always recommend you connect with a licensed agent or broker, someone who can help you make informed choices and protect what matters most. Because insurance isn't fear, it's freedom. All right, let's unwrap this. In episode 2, we talked about how young adults enter a system built long before they ever existed. That same system sets the prices, and lately those prices are rising in ways people can feel, not just see. Let's unwrap what's driving it. 1. Medical inflation is outpacing regular inflation. Routine visits, lab work, hospital stays, everything is costing more to provide, and that trickles into every premium. 2. Medications are more expensive than ever. We're in a new era of medicine. Gene therapies, biologics, GLP-1 medications, new cancer treatments, all groundbreaking, all expensive. Those costs land in the system and eventually in premiums. 3. Hospital mergers lead to less competition. When large systems merge, they often become the dominant option in entire regions. Less competition means higher negotiated prices and higher premiums. 4. Subsidy changes are shifting consumer costs. In episode 4, we talked about the Inflation Reduction Act and the enhanced silver plans it created. Those temporary protections are fading, and when subsidies shrink, consumer costs grow. And here's something most people never hear explained. The price you pay for a medication isn't a fixed number, it's a negotiated number. 2 people can walk into the exact same pharmacy on the exact same day and pay 2 totally different amounts for the same exact prescription. I had a client once who was charged for a medication we both assumed would fall under their prescription benefits. Turns out the way it was administered caused it to be coded as a procedure instead, and that made the cost of it skyrocket. But because I knew where to look and who to contact, I was able to tap into my resources and find a solution that saved them from paying an extra copay altogether. If you don't have guidance, you might end up paying way more than you should, even for medications that might be free with the right strategy. Some agents only look at the plan, but the right agent looks at you, your needs, your medications, and your budget. Insurance covers part of the picture, but a good agent helps you understand the whole thing. In episode 3, we talked about who actually helps you when something goes wrong. The reality today is when carriers cut commissions, you might lose access to knowledgeable agents who can guide you through these complexities. And without the right support, people tend to choose the wrong plans, networks get overlooked, drug tiers get missed, subsidies aren't optimized, bills go unchecked, people overpay without knowing it. Commission cuts don't just impact agents, they affect the quality of guidance consumers receive. If you've been following the series, you know we've talked about the first protectors, agents and brokers, and we've talked about the pressure those protectors face. Now we're talking about the next step in the chain. When the people who protect you are pushed out, you, the consumer, absorb the consequences. It shows up in your renewal letter, in your deductible, in your medication cost, in your surprise bills, even in your plan selection. It's all connected. Now let's shift from the problem to the power. Here's what everyday people can control. Number 1, review your plan with a licensed agent, a knowledgeable one. Not every agent goes this deep. Find one who looks at the whole picture. Number 2, check your prescriptions every year. Drug lists change, sometimes quietly. Number 3, choose plans based on usage, not hype. Low premium doesn't always mean low cost. We'll go deeper on metal levels in a future episode. Number 4, pay attention to subsidy changes. APTC adjustments can swing your costs by hundreds. Number 5, consider supplemental coverage. Accident, hospital indemnity, critical illness, the net under the net can often offset rising deductibles. 6, advocate for yourself. Tap into your agent as a resource. They will advocate with you. Ask questions, speak up. One thing is for sure, silence is expensive. Awareness leads to protection. If more people learn how to advocate with support from industry professionals, the decision makers, the carriers, the hospital networks, and the industry executives who shape these decisions will be compelled to make changes for the better. Congress and local government are also vital to helping us push for the changes that truly benefit the greater good. Whether you work with Core Insurance Services or another office, please make sure you're working with a licensed agent or broker. You deserve someone who explains things clearly, who guides you through the rising cost of care, and who helps you make confident choices. Because protection shouldn't be a privilege. It should be a promise. This has been Insurance Unwrapped, where we demystify coverage and bring clarity to a system that affects all of us. If you found this episode helpful, share it, subscribe, and stay connected. And if you have questions, drop them in the comments. If there's a topic you want us to cover in a future episode, let me know. I'm here to help you understand every part of this system. Your protection matters, your questions matter, and your voice has power. See you in the next episode.